person student today. We are going to be doing a head-to-toe exam. Do you have any questions for me before we get started?
Nope.
Okay, can I have your name
Lindsay Simi,
and your date of birth?
April 6th, 2002.
Okay, and do you currently have any allergies?
I do not.
Are you currently on any medications, which include prescription, over-the-counter supplements, or herbals?
Nope.
And do you currently have any diagnoses?
Nope.
And do you have any pertinent family history?
Not that I'm aware of.
Okay, and do you currently smoke?
Nope.
Drink?
Nope.
Do street drugs?
Nope.
Or vape?
Nope.
And are you currently experiencing any sort of pain, tenderness, aching?
Nope.
Okay, and could I have your name one more time?
Lindsay Simi.
And what season are we in?
I hope we're in spring, but we're kind of still in winter a little bit.
So it's very cold out. And what state are we in?
Michigan.
Okay, so you are alert and oriented ×3, which is good. That's what we want to see. And that's just checking your cognitive function to make sure everything is going well. And before we proceed, do you have any questions for me? Any concerns or things you want me to look out for?
Nope.
Okay, so we are going to go ahead and take a set of vitals. So if we did have a pulse oximeter, we would just place it on any of her fingers, and that just checks the SpO2, and a normal range is anywhere from about 97 to 99%, just depending upon the person. Same with the temperature. You could either take an oral or a forehead temperature, and that's usually about 97 to 99%, but it all just depends on the patient's baseline. So we will go ahead and take a blood pressure.
Okay.
Do you have a preferred arm you would like to use?
Nope. Doesn't matter.
Okay, so I will just use the one closest to me.
Okay.
So we will be listening with the diaphragm. So your blood pressure is 118/60, which is normal because one blood pressure is usually about 120/80, so that seems to be okay. So I'm going to go ahead and take this off, and I am going to take one of your pulses. Do you have a preferred wrist that I start with?
It doesn't matter.
Okay, so I'll just go ahead and use the one closest to me.
Okay.
Just got to locate it first, and then I'm going to check. So your pulse is at 80, which again, that's normal. It's right in the middle because the normal pulse is usually between 60/100. I'm going to go ahead and look at this side. So during that time, I did assess your respiratory rate, which is at 16, which is normal because a normal respiratory rate is anywhere from 12 to 20. That is good. Do you have any questions for me before we proceed? Okay, so I'm going to go ahead and start with your hands. You can just take a peek at those. I'm just looking for any sort of lesions, discolorations, anything that would be concerning. I'm not seeing any of that. Could you flip your hands back over? I'm just going to check the capillary refill on both of your hands. And both of those are under 3 seconds, which is good. That's what we're looking for. I'm just going to check any sort of clubbing or anything like that. Okay, and I'm not seeing any sort of clubbing, so that's good. Could you give my fingers a little squeeze? Okay, that's good. Your strength seems good. And could you push my hands up? Push them down. Push them out. And then push them in. Okay, that is good. That's just testing your hand strength, and your hand strength seems to be very good. And next I'm going to go ahead and look up the rest of your arms. So right now I'm just checking for symmetry, and your arms seem to be pretty symmetrical. And the temperature seems to be good. I'm not seeing any sort of lesions or discolorations or anything. I do notice you have a scar over here. Is that from a previous surgery or injury?
Yeah, I had 2 surgeries, one to get plates and screws in, and then one to get them out.
Okay, and did you have any sort of complications with infections or irritations with that?
No.
Okay, that is good. And can I take a little peek up your arms?
Yep.
Okay, I am just looking for any more sort of lesions or discolorations, and I'm not seeing anything too worrisome. That looks good. And then I am going to do some range of motion with you. Could you just make your wrists go like this? And then down and up. Okay, that is good. And then can you make a swimming motion? And go back. And then could you do it again on this side for me? And go back. And that is good. We were just assessing for any crepitus or that popping, cracking sound. I personally did not hear any right now, but have you had any in the past? Nope. Okay, that is good, and your range of motion seemed to be good. And then could you shrug your shoulders up for me? Okay, that was just checking your cranial nerve 11, which seems to be good and intact. Next, we are going to move down and assess your legs.
Okay.
So right now I'm just checking for any sort of symmetry, discoloration, or lesions, and I'm not seeing any discoloration and lesions, and the legs seem to be symmetrical with good temperature. Do you mind if I take one of your socks off? Go ahead. Okay, I am just going to be checking your capillary refill on your toes. And that does seem to be under 3 seconds, and I do notice that your toes are a little bit colder than the rest of your body. Is that normal?
Yes.
Okay. Okay, next I am going to test your foot strength, so if you could push my hands up, push them down, push them in, and then push them out. Okay, that is good. Your foot strength seems to be good, and next I'll have you do some range of motion.
Okay.
Could you just kind of make your ankles go like this? Okay, that is good. And then could you make your legs go out, swing out? Okay, that is good. Again, I didn't hear any sort of crepitus, that popping, cracking, but have you had any in the past? Okay, and the range of motion seemed to be good. So next thing, I'm going to move on and do your patellar reflex.
Okay.
Normally we would do it with a reflex hammer, but unfortunately we do not have one available to us, so I will be using the side of my hand. Both of your patellar reflexes seem to be working well. And next I am going to go ahead and assess some of your cranial nerves. First I'm going to go set this down. And then I do want to verify you do not have any allergies, correct?
Correct.
Okay. If I could just have you close your eyes. And could you just smell that for me? Okay, and what would you say that is?
Cinnamon.
Okay, that is good. That is just checking your first cranial nerve, and that seems to be good and intact. Next, I am going to be checking your cranial function of your eyes.
Okay.
So if you could just take a peek at my nose and just stare at that while I shine some light in there. Just keep looking at my nose. You're doing good. Just a little bit more. Okay, one more. You're doing good. Is good. Your pupils are round and reactive, which that's what we want to see. And then could you just take a look at my nose and then look at the wall behind me? Look at my nose, look at the wall behind me. Okay, that is good. Your pupils are accommodating well, so that is good. And then maybe look at the tip of my pen light and follow it. Okay, that is good. That is checking your 3rd, 4th, and 6th cranial nerve. So your pupils are round, reactive, accommodating well, and we did do the 6 cardinal fields of gaze. So that seems to be working well. Next, we're going to go ahead and assess your 5th cranial nerve.
Okay.
So could you tighten your jaw for me? Okay, that is good. And then I am going to touch a couple spots on your face.
Okay.
So if you could close your eyes and tell me where I'm touching.
My nose, my chin, my forehead, my left cheek.
Okay, that is good. Your 5th cranial nerve seems to be good, working, and intact. And the next, we're going to be assessing your 7th cranial nerve. Could you make a big smile for me? A big sad face? And could you puff out your cheeks? Okay, that is good. Your 7th cranial nerve seems to be working and intact. So next, we are going to go ahead and check the cranial nerves that work in your mouth.
Okay.
So could you stick your tongue out for me and wiggle that around? Okay, that is good. And then could you stick your tongue out and say ah? Okay, that is good. That was just checking the 9th, 10th, and 12th cranial nerve. So those seem to be working and intact. And then could you touch your nose? Touch my pen light? Touch your nose? Touch my pen light? Touch your nose? Touch my pen light? Okay, that is good. And then could you touch your fingers like this? And then put your hands on your lap and flip them over as fast as you can. Okay, that is good. That was checking your cerebellar function, and those all seem to be working and intact. Do you have any questions for me before we proceed?
Nope.
Okay, I am going to go ahead and assess your scalp.
Okay.
So if you could take your hair out of your ponytail. So I'm just looking for any masses, bumps, any sort of skin flakes. I'm not feeling anything, and I'm not seeing any sort of flaking or dandruff. Have you had any history of dandruff in the past? Okay, you can go ahead and put your hair back up if you'd like. Okay, next I am going to be taking a little peek at your ears. So I do see you have your ears pierced. Have you had any issues with irritation or infection?
Nope.
Okay, those look good. Your earrings are very nice.
Thank you.
You're welcome. Okay, your ear looks symmetrical and the color looks good. I'm not seeing any sort of polyps or foreign bodies. Okay, next I am going to be taking a look at your eye mucosa. So I'm just going to place my hands gently under your face, and if you could just take a little peek up to the ceiling. Okay, your eye mucosas look pink and moist, and those look good. And then I'm going to palpate or touch your sinuses.
Okay.
So I'm going to start with feeling the one on your cheeks. Okay. Does it hurt at all? Nope. Okay, not feeling any sort of tightness or distension. And that was your maxillary sinus, and this is now your frontal. Again, is this causing any sort of pain or any discomfort? Nope. Okay, that I didn't feel any tightness or distension there either. Next, I am going to take a peek up your nose.
Okay.
So if you just look back for me, I'm just going to put your nose up. Okay. I didn't see any sort of deviation, polyps, or anything like that. And the mucosa in your nose looked pink and moist, and that looked good. Have you had any issues with nosebleeds or any sort of runniness or stuffiness? Okay, I am going to take a little peek inside of your mouth. Okay, and do you still have your tonsils?
No, I do not.
Okay. And then could you put your tongue up for me? Okay, that looks good. Your soft and hard palate seem and look intact. Your tongue looks good. I'm not seeing any sort of lesions or white spots or anything worrisome. And then have you had any issues with bleeding in your gums? Nope. Okay, I am going to move on and feel your lymph nodes. Okay, so this is your occipital lymph node, your postauricular, your preauricular, your submandibular, your submental, your cervical chain, and can you pop out your clavicles? Yep. Your supraclavicular, and those are all non-palpable, which just means that I don't feel anything. If I was to feel something like a little bump or almost kind of like a hard marble, that could just mean you have some kind of infection or something going on, but I'm not feeling anything, so that is good. And I am just going to take a little pinch of your clavicle. Okay. Your tissue turgor looks good. You have non-tenting skin, which just means your skin's just going right back to how it was before. It just shows you got some good hydration If you are never not hydrated well or dehydrated, the skin might tend to stay up a little bit longer. So next I am going to do your carotid arteries. I am going to feel them. Do you have any history of coronary artery disease in yourself or your family, or any issues with your arteries in general?
No.
Okay. So I'm going to feel them one at a time.
Okay.
And then I'm going to do the other side. Okay, those feel good. They are symmetrical and bounding. Excuse me. Which is what we want to see. Those look good. And now I'm going to auscultate them. I will be using my bell and just checking for any sort of bruise or anything like that.
Okay.
And then when I do this, could you please hold your breath? Side. Okay, those sounded good. I didn't hear any sort of bruise or anything like that. Then I am just going to take a peek at your neck. You do seem to have good tracheal alignment. I'm not seeing any sort of discoloration or any lesions on the skin that would be worrisome. Do you have any questions for me so far?
No.
Okay, I am going to take a peek at my sheet.
Okay.
And then we are going to move to the back.
Okay.
And we are just going to be moving. I do have to just go turn off an alarm. I apologize. Okay, was that too close, do you think?
I think it's okay.
Okay, if I could just have you rotate, turn a little bit. That looks good. And I am going to go ahead and feel your thyroid.
Okay.
I am going to be placing my hands around your neck. Is that going to cause you any alarm?
Nope. Thank you for asking.
Oh, you're very welcome. Okay, so I am just going to be slightly moving your trachea out of place.
Okay.
And you could just swallow for me. That is good. And if you could just swallow for me. That is good. Your thyroid is non-palpable, so that just means I'm not feeling anything, no enlargement or anything like that. So if I was to feel it, it would just mean that you might have an issue with your thyroid going on, but currently I am not feeling anything. Okay. Next, I am going to check the ratio, so I will be placing my hands about right in the middle of your chest and on your back and then your sides. Okay. Your ratio is 2 to 1, which is good. That's normal. If you had a 1 to 1 ratio, that could just mean that you have some sort of barrel chesting going on, which just means you're having some sort of respiratory issue. So next we are going to be listening to and percussing your lungs.
Okay.
Are you having any sort of pain or anything in the back that would inhibit me from being able to percuss them?
No.
Okay, so can I undo the back of your gown?
Yep.
Okay, first I am going to check your spinal alignment.
Okay.
Okay, and your spine does seem to be in line and straight. Now I will just check for symmetry of the body cavity, and that seems to be good. And next I am going to go ahead, and if you could just scoot back a little bit for me. Okay, thank you. I am just going to be listening, and I will be using the diaphragm to listen to your lungs.
Okay.
And first, could you just take a big breath in for me?
Yep.
And out. Okay, that is good. We will be stopping listening to your lungs about here. And then could you take a big breath in and out, and in, 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 in and out, and in and out, and in and out, and in and out. Okay, your lungs do sound bilaterally clear, so that is good. That is what we want to hear. And if we did hear anything, it might be like popping or cracking or some sort of wheezing, but we do not want to hear that, and that is good that we didn't hear it. So I am going to go ahead and start percussing your lungs. So it's just going to be kind of like a little tap on the back. So just let me know if anything is painful or uncomfortable for you.
Alrighty.
Okay, those sounded good. Those were resonant, which is just the normal sound we want to hear in your back. And I am just going to inspect the skin really fast. We're not seeing any sort of discoloration or any marks or lesions or anything. I'm going to get you tied back up. And then I am going to get you laid down so we can assess some of your heart sounds and the rest of you. Okay, you can just have you rotate back around. And then we can get you laying down and then move back. Okay, and if you just want to lay down for me, get you covered up.
Thank you.
You're welcome. Is that comfortable for you? Okay, I am first going to assess for JVD in the neck.
Okay.
So I am just going to get an eye length with your neck and just look to see if there's any bulging out in the vein. And I'm not seeing anything. And JVD just stands for jugular vein distension. So we're just looking to see if you have any puffiness right here, which just means you might have some fluid overload going on. And if you did have any of the JVD, we would just raise the bed to about no more than 45 degrees to see when it would go away. So I am going to grab the camera and we can readjust the angle, but first I will get the back of your thing untied if that's okay with you.
Yep. This way, correct?
Yes, that's okay.
Okay.
Okay. So we are going to go ahead and listen to your lungs, or your heart sounds. Excuse me.
Need to find a good way to hold this. The iPad. Okay.
Okay, and is it okay that I pull the top of your gown down a bit?
Yes. Let's let me move my hand real quick.
Okay.
I'm just trying to find a good way to hold the iPad. Okay, I think I got it.
Okay. So we are going to be looking for the second intercostal space on the right-hand side, which is the aortic valve. Okay, first we're going to listen with the diaphragm, and we're going to hear a lub-dub sound. Okay, that is good. We're going to be now switching to the bell. We're just listening for any sort of murmurs or anything. Okay, I'm not hearing any sort of murmurs, so we're going to switch back to the diaphragm. Now we're just going to be doing on the left side, second intercostal space, and that is the pulmonary valve. We're just listening with the diaphragm for that lub-dub sound. Okay, that sounds normal. Next, we're going to be switching over to the bell. We're listening for any murmurs. Okay, I'm not hearing any sort of murmurs, so we're switching back to the diaphragm, and now we're going to be looking third intercostal space, which is Erb's point, and we're going to be listening with the diaphragm. Okay, I'm hearing that love dove sound, which is good. And we're going to be switching it over to the bell. Just looking for any of those murmurs. Okay, I'm not hearing any murmurs. And it is okay if I go up from the bottom of your gown?
Yes.
Okay. Okay, here's the fourth intercostal space, which is the tricuspid valve. Is it okay if I pull your bra up a little bit?
Yes. I just want to make sure the camera can see me. There you go. That's good.
And we're just listening for that love dove sound again. And this is the fourth intercostal space, which is the tricuspid valve. Okay, and we are going to switch over to the bell. And again, we're just going to listen for any murmurs. Okay, I'm not hearing any murmurs or anything. So we're going to switch back over to the diaphragm. Then we are going to go to the fifth intercostal space, which is the mitral valve. And this we will be listening for a full minute. So this is the fourth. And then we're just going down to the fifth intercostal space, which is just mid-clavicular. Okay, so your pulse was 80, and which is normal because again, a normal pulse is anywhere from 60 to 100. So I am going to go ahead and switch it over to the bell to listen for those murmurs. Okay, and I'm not hearing any murmurs, which is good. So I'll go ahead and get you covered back up.
I'm just going to rest my arms for a second.
So next we are going to move on and do a GI assessment.
Okay.
So I am going to, is it okay if I pull the blanket down a little bit to expose your abdomen?
Yep.
Okay. Okay, is it okay if I pull your shorts down a little bit as well?
Yes.
Okay, and at first we are going to inspect the abdomen.
Okay.
So we are looking for the aortic pulse, which I do see is about right here on her. And I'm just looking for any sort of lesions or masses or anything that is abnormal, and the symmetry of the abdomen does seem to look good. So next we are going to auscultate the abdomen. We are going to do the 4 different quadrants, and then we are going to do the aortic or cardiac portion of the GI. So I will be using the diaphragm, and we are going to be starting at the right lower quadrant, and we are going to be looking for about 5 gurgles per quadrant. Okay, so I heard about 5 gurgles, so I'm going to move on to the right upper quadrant. Okay, I heard about 5 gurgles, so I'm going to move on to the left upper quadrant. Okay, so I'm going to move on to the left lower quadrant since I heard 5 gurgles. And I heard 5 gurgles, so that just means you have an active bowel, which sounds good. And I did, okay. So I am at the diaphragm, and I am now switching to the bell. So we are going to auscultate the aortic pulse first. So I'm just going to recheck for it. Okay, which it is right here. So we're just listening for any sort of bruise. Okay, I'm not hearing any bruise. I'm now going to go to your renal. Okay, I'm not hearing any bruise over here. I'm next going to go to your other renal. Okay, I'm not hearing any bruise. I am going to move to your iliac. Is it okay if I just pull the top of your shorts down a tiny bit?
Yep.
Okay, I'm not hearing any bruise here, so I am just going to move over to the other side. Okay, I'm not hearing any bruise here. I do have to listen to your femoral arteries. Do you have a preference if I go from the top of your shorts or from the bottom of your shorts?
It doesn't matter, whatever works for you.
Okay, I will palpate them first, and then I will listen to them.
Alrighty.
Just so we don't have to go down your shorts twice.
Okay.
Okay, so I will pull this down for now, and then we'll come back and do that after.
Okay.
Okay. I'm just going to lift up your shorts if that's okay with you.
Yes.
Okay, if you could just lift your leg up a little bit, I'll pull it up.
Sorry.
No, you're good. Okay. Oh, wait, I'll put my legs up first. There we go. Okay, so we are currently feeling both of your femoral arteries, so they are both bounding and symmetrical, which is good. And next I'll just go ahead and auscultate them. And we are using the bell for this, so we're just again assessing for any bruise. Okay, I'm not hearing any bruise here. Okay. Okay, I'm not hearing any sort of bruise there. So that is good. Now just get your shorts pulled back down and into place.
Okay.
And bring that blanket back up for you.
Okay.
Okay, we'll get your gown back and pulled up, and we are going to percuss your abdomen. So we are going to start with the 4 quadrants, and then we are going to go to your liver. Okay. So I am going to start with your right lower quadrant. Your right upper quadrant. And your left upper quadrant. And then your right lower quadrant. Okay, and we did hear tympani in your GI tract, which is normal. It's just because you got a lot of air in there. So we are next going to go up and percuss to your liver.
Okay.
So we are going to start down here, and your liver is going to be about right here.
Okay.
Okay. And that dull sound, that's just the liver, and that's just the normal sound we want to hear when we go to the liver.
Okay.
So next we are going to palpate your abdomen. We are going to start with light palpations, and then we're going to move to some deep palpations.
Okay.
So is there any discomfort or tenderness or anything you want me to avoid?
Nope.
Okay, first we're going to start with some light palpations in your right lower quadrant and your right upper quadrant. Is that hurting at all?
No.
Your left upper quadrant, your left lower quadrant. Then we're going to move to some deeper palpations. Is that okay?
Yep.
And currently I've not felt any sort of distension or any sort of tightness. Okay, is that hurting at all?
No.
Okay, that's in your right lower quadrant. Okay, in your right upper quadrant. Your left upper quadrant. And your left lower quadrant. Okay, and that is good. Again, I'm not feeling any sort of tightness or distension. Did that cause any sort of pain for you?
No.
Okay, so I will get you moved back down, and then I will move to your legs.
Okay.
And readjust the camera. I won't. There you go. I did cut your head off. I apologize. Okay, so we are moving on to your legs. Since we did already assess your femoral arteries, we're going to be doing the arteries in your legs. So is it okay if I pull the blanket up?
Mm-hmm.
Are you comfortable?
Yes.
Okay. Okay, we are going to be feeling for the popliteal pulse, which is just going to be right behind your legs.
Okay.
Or your knees. Okay, and that is symmetrical and normal, so that sounds good or feels good. And I'm going to be moving to your post-tibialis. Okay, that feels symmetrical and normal to weak, which is normal just because it is so far away from your heart.
Mm-hmm.
And then is it okay if I take your socks off?
Yes.
Okay, and you will be feeling the dorsal pedis pulse. That is just going to be right on the top of your foot. Okay, that is symmetrical and weak. Is that normal for you?
Mm-hmm.
Okay, and I will be assessing for edema. Okay, and I would give you a 0 on the edema scale. I'm not seeing any sort of fluid overload or anything down there. I am going to check the symmetry and the color of your legs. Okay, symmetry seems good. The temperature seems good. And I'm not seeing any sort of lesions or anything like that. I do notice that your feet are a bit colder on both sides. Is that normal for you?
Yes.
And let me just check the capillary refill on both of your toes. that is less than 3 seconds on each one, so that is normal. And I am going to do a sharp to dull test on you. Is that okay?
Yes.
Okay, let me grab my instrument. Okay, so I am going to give you a test, or just show you what they feel like first. Okay, so that's going to be sharp.
Okay.
Can you feel that?
Yes.
And then that's going to be dull. Can you feel the difference?
Yes.
Okay, so if you could just close your eyes, I am going to do it on both of your legs, and could you just tell me the location and if it's sharp or dull?
Sharp left shin. Dull right top of foot. Sharp right shin. Dull left leg side of calf. Dull left top of foot. Sharp right leg side of calf.
Okay.
Dull left bottom of foot. Dull right bottom of foot.
Okay, that is good. You got an 8 out of 8 on the sharp and dull test. So I am going to put your socks back on. Do you have any questions for me in the meantime?
No, I don't.
Get your legs covered back up.
Okay.
Get you sitting up, and then I will go take a look at my sheet one last time.
Okay.
And then before I get you up and walking.
Okay.
Okay. So I will kind of just readjust the camera for now. And I'll put it down here so you can see me putting your shoes on. And then we are going to be getting you up and doing some walking, but first I am going to put your shoes on.
Okay.
You can probably do it.
Yeah.
Just let me know if you need any assistance.
Okay. Sometimes I tie them a little too tight.
Okay, that's good. And camera angle. Okay, that's good. So we are going to be getting you. Let me tie you in the back first
Okay.
before we get you up. Okay, so we are going to be getting you up.
Okay.
Okay. And do you have any sort of dizziness or anything like that?
Nope.
Okay, I am going to have you stand with your hands at your sides for about 20 seconds with your eyes closed.
Okay.
Okay. You can open your eyes. I would give you a negative on the Romberg test. That's just a test to see if you are swaying or moving or anything like that.
Okay.
And that is also testing your 8th cranial nerve,
Okay.
which is good. So I am going to have you take about 10 steps this way.
Okay.
And it's just going to be about 10 normal steps, and then it's going to be about 10 steps back, which is just going to be about heel to toe.
Okay.
So I'm going to walk with you the whole time. And before you walk, are you sure you're not lightheaded, dizzy, or anything like that?
Mhm.
Okay. And then heel to toe on the way back. Okay, and if you just want to sit back down. Okay, I am going to adjust the camera angle. Okay, and did you feel uneasy at all while you were walking?
No.
Okay, so your gait or your walking, in my opinion, looked good. You didn't look unsteady at all. Do you have any dizziness or pain that came from the walking?
Nope.
Okay, that is good. I do have a few follow-up questions for you.
Okay.
What would you say your nutrition or your diet is like?
I try to eat like 2 to 3 meals a day. I really like salads and bagels and like chicken and rice and potatoes.
Okay, I would say that sounds like a really good balanced diet. So that sounds good, and you seem to be pretty mobile on your own. And when I was just doing your assessment, I didn't feel any extra moisture on your skin or anything like that. So in that case, I would give you a 23 out of 23 on the Braden scale, which the Braden scale is just a scale that determines or is a thought about how much you are at risk for getting pressure ulcers. So I would put you at a really low risk, which would be a 23 out of 23, which is the highest score. And to end today, do you have any questions or concerns before I head out?
Mm-mm.
Okay, well, if you do end up having any questions, please feel free to follow up. And it was a pleasure working with you today.
Thank you. You too.
Thank you. Have a good one.
You too.